us talk about anticoagulants. These are medications that stop coagulation, like anticoagulation. So there are a list of medications, not just limited to heparin, low molecular weight heparin like enoxaparin, dalteparin, fondaparin. We still have warfarin, rivaroxaban, dabigatran, apixaban, medoxaban, clopidogrel, aspirin, and rest of them. These from rivaroxaban down, these are called DOAC, direct oral anticoagulant, because those ones are in pills. You can take them orally. Then some of them are injectable. So let's go over to uses. They are used in patient that has lupus erythematosus, myocardial infarction, post-surgical clot formation like in heart surgery, valvular repair of the heart valve. We can also use it in knee or hip surgery, like people receive it who undergo arthroplasty. We have atrial fibrillation. Anticoagulant can be used in atrial fibrillation. We have DVT, deep venous thrombosis, commonly prescribed. We have pulmonary embolism. These are cases where anticoagulant can be prescribed. Let's look at their mechanism of action. What they do is that they disrupt coagulation cascade process. If you could remember the intrinsic and extrinsic factors and how each of them play a role to make the platelet to aggregate and block a vessel that is severed. So exactly what they disrupt, those processes of creating larger number of clots is impaired. And you should know that this medication does not break existing clot. What they do is they reduce the process of clot formation. There are some other medications that actually break the clot that is already formed, like the RT-PAS, urokinase, and some of them, and that's not part of our topic today. So we will look at their side effects. Some of the side effects of this medication are: the major side effect of this medication is bleeding, bruising, osteoporosis, hair loss, and GIT upset, like nausea and vomiting and rest of them. So it is important to note that bleeding could occur at various places, like any of the body mucous membrane orifices, including the eye, nose, stool, urine. So we just watch out for bleeding from those body orifices. Then we'll go over to nursing action or nursing responsibility. One of the things you need to watch out for is you monitor for bleeding by monitoring the lab findings. Here, the GP or the doctor will prescribe complete blood count. So you need to keep your eye on the hematocrit, that is the packed cell volume, and the HB, the hemoglobin count. If they are reducing the number, you know that the person is bleeding. You also need to assess for bleeding, because once you are on this medication and the bloods are not aggregating the way it should be, so the person is prone to bleeding from any of the body orifices, maybe from the nose, mouth, from the eye, from the anus, from the urethra. Any of the body orifice is prone to bleed. You also need to check the excreta, but the urine, if it's dark colored, it could be a sign that someone is bleeding. You can also check the stool. If it's dark, tarry, sticky, so it could be a sign that someone is bleeding. Then you do your OBS, which is one of the major responsibility of a nurse, to monitor the OBS, the complete vital signs according to the news. So so far as the person is bleeding, it will score on the news of about 3 to 4 scores, which you need to escalate and monitor according to the news. So in your observation, you should expect to see tachycardia with hypotension as a sign of bleeding, because once the bleeding is high, the heart will be trying to compensate by increasing the heart rate, and the lung also try to compensate the mechanism, and there will be increased heart rate. Meanwhile, the BP will be reduced because the volume of the blood is low to carry on with the tissue needs.